Welcome to the KanCare Ombudsman Liaison Training. The KanCare Ombudsman Office is here to help Kansas Medicaid applicants and members and those who assist them to navigate the system and resolve their KanCare issues so that they can get and keep their KanCare services. Today we'll be doing an overview of the programs for the elderly and persons with disabilities. In this lesson, we'll specifically be covering the nursing facility and PACE programs and how to calculate the monthly cost share for each of these programs. We'll also be covering the Medicare Savings Program, sometimes called MSP. We're just going to touch lightly on each subject today, but you can find more in-depth resource and educational materials on the KanCare website in the Ombudsman section. You can go directly to that section with the link www.kancareombudsman.ks.gov. And again, at the end of this video, we'll provide clear instructions on how to get any resources mentioned in this video. To apply for any of the programs just mentioned, you can use the KanCare application for the elderly and persons with disabilities. This application is used to apply for programs for persons who are over 65, individuals of any age who are determined blind or disabled by Social Security rules, having the determination of SSI or SSDI, or number 3, those individuals with a pending disability case with the Social Security Administration. So someone that has recently applied and has a pending case, or someone who has been denied a disability determination by Social Security and they are actively appealing that disability case denial. This application is also used for individuals applying for nursing facility, HCBS, and PACE programs. We're moving our way down looking at the next program on the KanCare application for the elderly and persons with disabilities. The next program we're going to be looking at is the nursing facility program. On the application it says nursing home or other long-term care facility. For the nursing home program, it's for children and adults residing in a nursing home, medical or mental health institution, or similar facility for a long-term stay. Like all KanCare programs, financial eligibility is based on income level. For the nursing facility programs, members are responsible for a portion of the cost of their care in the form of a monthly cost share called a patient liability. It's the amount they'll pay each month for their care. It's their portion of the cost of that care. You'll take their total gross monthly income, so their monthly income before any kind of deduction, minus protected income level, and that's going to be their monthly cost share or their monthly patient liability. Let's do an example of calculating the patient liability for nursing facility coverage. We've got Henry here with a gross monthly income of $864 a month. So that is his income before any deductions. The protected income level for the nursing facility program is $62. So that's the amount of Henry's income that is protected and cannot be spent on or toward his medical services. That's his money to buy cigarettes or do whatever it is he wants to do with that money. It can't be used toward his medical services. So do the calculation of total gross monthly income minus the protected income level. We've got $864 minus 62 leaves Henry with $802 a month that he'll need to pay in a patient liability. That is his share of the cost for nursing facility services, and he will pay this directly to the nursing facility. So if you think about the most conservative you could get is about $5,000 a month to live and receive services in a nursing facility. So based on this calculation, he would pay $802 of that $5,000 a month, and the state would pay the rest. Let's do another example, this time Frida, also in a nursing facility. And working with KanCare's nursing facility program. Frida's combined grossly monthly income from pension and Social Security is $2,000 before any deductions. Again, the protected income level is $62 for a nursing facility. So we've got the calculation is total gross monthly income minus protected income level. And so we've got 2,000 minus 62. That leaves Frida with $1,938 in a monthly patient liability. That is her monthly cost share for those services. She must pay this monthly cost share to her nursing facility each month to continue to receive those services. So we have created a worksheet to help you understand or to guide someone in how to understand how to calculate their monthly patient liability for nursing facility coverage. On the front, it has a completed example that you can take them through, and on the back, there's a fill-in-the-blank version so they can plug in their own numbers. Let's take it from the top and just go through this. Our example will be Mary, and she has a Social Security and pension combined give her a $1,500 a month income. Now that's always gross before any deductions. And then you've got your protected income level, which we know is $62 for nursing facilities in the pink, and then the next line down in the yellow shows the formula for nursing facility patient liability, which is monthly income minus protected income. So we've got her $1,500 gross monthly income minus $62 protected income leaves her with a $1,438 amount for her monthly patient liability. Now that's before any allowable expenses. If she's paying for something every month that insurance won't cover, but that is medically necessary, or if she's paying for additional health insurance, things like that, certain things would be determined an allowable expense, and therefore they would deduct those from her monthly patient liability amount. So let's say that Mary has some extra Blue Cross Blue Shield coverage that's costing her $200 a month. Well, she can keep that, and they will deduct that from the bottom line, that premium that she pays every month of $200. So look in the very bottom square of that worksheet, and we've got a new calculation, $1,500 gross monthly income minus $62 protected income minus the allowable expense of $200 for her Blue Cross Blue Shield insurance premium she also pays out of pocket every month. That gives us a lower patient liability of $1,238 a month that Mary's responsible for. That's her cost share for nursing facility coverage after the allowable expense has been added in there. Again, that's what she'll pay to the nursing facility every month to receive that care and those services. Again, remember, if the nursing home or nursing facility costs are over $5,000 a month, she's still only responsible for that $1,238. The state would pay the rest of those covered services. Why are the protected income levels so different? Why is the protected income limit so much lower for the person residing in a nursing home than for the individual getting HCBS services? For example, in a nursing home, you pay a monthly patient liability. The protected income level is only $62. They only allow the person to keep $62. And in for HCBS situation, the person has to pay a monthly client obligation, and that client obligation is calculated based on a protected income level of $1,177. That amount is protected. Why so low for patient liability? Why are these so different? For nursing home, the long-term care facility provides the rent, the utilities, and food in addition to the medical expenses for the individual living in the nursing home. So less money is protected because all of that is covered. However, if you're living in an HCBS coverage situation, you need that higher protected income level to pay for other needs. The person with HCBS services is still living in the home or in an assisted living facility and has other cost of living expenses such as food, utilities, and possibly rent. This client obligation or monthly cost share is just for the medical expenses. It's not going to cover rent. Thus, their protected income level is higher to allow for these costs of living expenses that must still be paid separately by the individual. There is a fact sheet called the Patient Liability or Client Obligation Fact Sheet, and it explains the 3 different cost share programs, the spend downs, the patient liability, and the client obligation, and it also gives you an example calculation of a client obligation. The Program of All-Inclusive Care for the Elderly, otherwise known as PACE, is the next program we're going to talk about. The Program of All-Inclusive Care for the Elderly, which is PACE. This program is for persons 55 and older. If you are applying through Medicaid for financial eligibility, you'd need to be 55 and older with a disability, or 65 and older, just because it's through Medicaid. It's for persons who need a nursing home level of care. The functional assessment is going to be determined by your local ADRC, same organization that determines the functional assessment for nursing facility and also for the FE waiver services. This is for individuals who can live safely in the community with the help of PACE services, and for those who live in the service area of a PACE organization. So currently PACE is not available to everyone. You do have to live in a county that has a PACE organization. So currently these are the counties. Via Christie Hope covers Sedgwick County, and you can call 316-858-1111 for Sedgwick County. Midland covers Douglas, Jackson, Jefferson, Leavenworth, Lyon, Marshall, Nemaha, Osage, Potawatomi, Shawnee, Wabunsee, and Wyandotte. Their number is 785-232-2044. And Bluestem covers Dickinson, Ellsworth, Harvey, Lincoln, Marion, McPherson, Ottawa, Reno, Rice, and Saline counties, and that's 844-588-7223. And again, there will be a resource that will give you all these phone numbers at the end of the video. What you pay depends on your financial situation. PACE uses Medicare and Medicaid funds to cover all medically necessary care and services. You could have Medicare only or Medicaid only, or even be dual eligible and get PACE. You could also pay for PACE privately. PACE is, like any KanCare program, based on income level. Some individuals are going to be responsible for a portion of the cost of their care in a monthly cost share called a PACE participation obligation. And again, it will be that same calculation we used for HCBS or Home and Community-Based Services, which is total gross monthly income minus the protected income level of $1,177 equals the monthly cost share for this program, or the monthly PACE participation obligation. Let's do an example of how to calculate a monthly PACE participation obligation, or the monthly cost share for PACE coverage. Frida, her combined gross monthly income before any deductions from pension and Social Security is $2,000 a month. The protected income level for PACE program is the same as for the HCBS, or Home and Community-Based Services program. It's $1,177. So we take her total gross monthly income minus protected income level, and we get $823 a month. That is Frida's monthly obligation for the PACE program. She must pay this monthly cost share to her PACE organization each month to continue to receive those services. Let's do another example of how to calculate a monthly PACE participation obligation. Henry's gross monthly income is $864. The protected income level for PACE is $1,177. That is the amount of Henry's income that's protected and cannot be spent on PACE services. Because his gross monthly income is below the protected income level amount, then he will have a zero client obligation. Henry's monthly PACE participation obligation is zero. This is his share of the cost for PACE services. The Ombudsman's Office has created a PACE participation obligation calculation worksheet so that you can lead somebody through so they can understand how it's calculated. And also there's a fill in the blank version on the back so they can plug in their own numbers. Let's use Mary as an example. She's got a combined income of Social Security and pension that equals $1,500 a month. That's her gross monthly income before any deductions. We subtract the protected income level from that, so it is $1,500 minus $1,177, leaves Mary with a $323 a month cost share or PACE participation obligation. That's before any allowable expenses. If she happens to have anything that can be deducted from that, medical expenses that are medically necessary she's paying for out of pocket, or perhaps other insurance premiums for additional health care, those things can be deducted from that amount. So let's say she has a $200 a month Blue Cross Blue Shield insurance premium she's also paying. So they'll deduct that amount from the monthly PACE participation obligation total amount. So look at the very bottom. We've got her $1,500 total gross monthly income minus the protected income level of $1,177 minus an additional allowable expense cost of $200, and now Mary has her monthly cost share for PACE services or her monthly PACE participation obligation down to $123 a month, and that's the amount she'll pay the PACE program. PACE providers. Individuals receive long-term care coverage through a managed care network, which is a PACE network. You are required to use PACE contracted providers, and it is set to meet any and all needs that the consumer is assessed to have. So PACE is really kind of in between HCBS services, where you get all your services at home, and a nursing home where you get all your services at the institution. PACE, someone lives in the community, but they go to a PACE center during the day, and there's social activities there, and then there's all different types of providers there, so they can get podiatry there and therapy there and social services. There's medical services. Basically all their needs are going to be in that one place. So it's kind of something that's right in between. Plus they do have respite services for caregivers at home. PACE service package must include all Medicaid and Medicare covered services. And if your healthcare team decides you need care and services that Medicare and Medicaid do not cover, PACE may still cover those too. The Medicare Savings Program. This is the last program listed on the KanCare application for the elderly and person with disabilities. The Medicare Savings Program isn't actually a program that's going to give you medical coverage, but what it's going to do is save you money. If you have Medicare and you're paying Medicare premiums every month, or you pay deductibles or co-payments for your Medicare, this program allows the state to pay those premiums, co-payments, and deductibles for you. Of course, it's based on income. Medicare Savings Program has 3 levels: QMB, LMB, and ELMB. The QMB level, Qualified Medicare Beneficiary, that's the level where the person, the applicant or the member, is making the lowest amount of income, so they're getting the highest amount of help from the state. So their Medicare out-of-pocket costs, such as their Part A, Part B, and Part D premiums, Medicare co-payments and deductibles and co-insurance, they're either getting that very highly discounted or free. And then as you make more income, you simply get less help from the state. So if you are LMB, low-income Medicare beneficiary, well, then you make too much money to get qualified as QMB, but you'll still get assistance from the state. You just won't get as much. And then if you get ELMB, expanded low-income Medicare beneficiary, well, you make more than even an LMB member makes, so you'll get less help. because you make more income. Again, all of these will help pay for, and then sometimes these things will be free, your Medicare premiums and other out-of-pocket costs. So on the application, on page 3, it asks you, is this person applying for medical assistance? You'll want to check the Medicaid program you're applying for, and then if you have Medicare, you also want to check the Medicare cost program. Checking the Medicare cost box alerts eligibility specialists to check for their ability to enroll in Medicare Savings Plan in addition to the regular Medicaid program. If you were to check the Medicare cost only box, you're asking Medicaid coverage not to be considered, and you only want the Medicare Savings Program. If that's something you want, you don't want Medicaid, and you only want the Medicare cost program, there is a separate, much shorter application for just the Medicare Savings Program. Again, at the end of this video, you'll have instructions to find that resource. Where can I go to learn more about Medicaid-related resources, ongoing education, and ongoing support? To find resources we've covered in these videos and additional Medicaid-related resources, you can go to the KanCare website. The direct URL for the KanCare website is https://www.kancare.ks.gov. Then, once you're on the KanCare website, look for the KanCare Ombudsman section in the toolbar to find the KanCare Ombudsman's webpage. The direct URL for the KanCare Ombudsman's webpage is https://www.kancareombudsman.ks.gov. From the Ombudsman section of the KanCare website, next you'll go to the Resources page. That direct URL is https://www.kancare.ks.gov/KanCare-office/resources. When you click on that resources link on the Ombudsman section of the KanCare website, you'll see listed all the resources we talked about here today and a lot of additional Medicaid-related resources. Also, on the KanCare Ombudsman's webpage, you can see the KanCare General Information Fact Sheets. To go directly to that URL is https://www.kancare.ks.gov/KanCare-ombudsman-office/KanCare-information-fact-sheets. When you click on that KanCare General Information Fact Sheets, here is an example of the page you'll see. Of course, we're constantly updating this and updating the information that's there and also adding more. So a lot of good resources here as well. Some of these we've mentioned in the video, and some of these are additional resources. Also, on that KanCare Ombudsman webpage, you can look for the community training link in the drop-down menu. The URL directly to that community training link is http://www.kancare.ks.gov/KanCare-ombudsman-office/volunteer-program/ongoing-education. There will be videos. These videos that you're watching right now are posted there, and any updates we do to the videos or added videos will also go on this section. There's also, if you'd like to register for in-person training, you can register for a class near you. If you're a KanCare applicant or member and you're needing help to resolve a KanCare issue, we are here to assist you. Also, if you're a provider assisting someone or a family member or a neighbor and you're trying to help a KanCare applicant or member, we are here to help you also. Give us a call. Our toll-free number is 1-855-643-8180. Again, that's 1-855-643-8180, or email us at kancare.ombudsman@ks.gov.